eruption of Mount Liwatobi in East Flores Regency, Indonesia last November has affected and displaced 13,579 people and have to be evacuated from their homes in 8 villages. Officials said that more than 9,000 individuals are still sheltering in 7 centralized evacuation camps prepared by local government, while others are staying with relatives or in independent camps across 52 villages in 10 subdistricts of East Flores and Sika Regency. Responding to this disaster, Caritas Indonesia, in collaboration with Caritas Diocese of Larantuka and Caritas Diocese of Maumere, immediately implemented an emergency response to help survivors, especially to fulfill their basic needs in emergency situation. Until now, Caritas has distributed aid to 13,321 beneficiaries in the form of basic food packages, hygiene kits, sanitary kits, clean water, and sleeping equipments. On November the 30th, the handover of humanitarian aid to the affected residents in Algarong village was attended by the chairman of the Karina Foundation, Monsignor Aloysius Sudarso, and the executive director of Caritas Indonesia, Father Freddy Ranti Tarik, and accompanied by the director of Caritas Diocese of Larantuka, Father Franciscus Severius Hurant, and several parish priests in the surrounding area. At this particular time, the humanitarian aid is prioritized for vulnerable survivors who live in independent evacuation camp in 3 different sites. On that occasion, Father Freddy Ranti Tarik, as executive director of Caritas Indonesia, specifically expressed his gratitude to the donors and all parties who have helped, that the emergency response implementation runs pretty well. In addition, Caritas Indonesia also provides health services for survivors, for those living in centralized evacuation posts and also for those staying across many independent evacuation sites. Lack of clean water and poor sanitation conditions in evacuation camps have led to the emergence of infectious diseases that has to be treated seriously. These services are carried out in collaboration with many institutions, including hospitals and congregations. Caritas Indonesia is determined to support affected residents through several humanitarian programs that will be implemented after the emergency response period ends, and has planned to run programs in several sectors, including shelter, clean water, livelihood, and health. To ensure the implementation of the above program, Caritas Indonesia conducts active consultations with Caritas Internationalis member organizations in the country, and keep coordinating with National Network of Caritas Indonesia. On behalf of affected residents in East Flores and Sika Regency, we are very grateful to the parties and institutions who provide support in various form of assistances.